Now coming to the inflammatory disorders of eyelid glands. Okay, eyelid glands. There are four diseases: external hordeolum, internal hordeolum, chalazium, molluscum contagiosum. Okay, today we are going to dealing with external hordeolum and internal hordeolum. Inflammation of eyelid. First is external hordeolum. It is also known as style. Okay, it is acute inflammation of the eyelash follicle and its glands. That is gland of Zeiss and glands of Moll. Okay, gland of Zeiss is sebaceous gland. Okay, and gland of Moll is sweat gland. Okay, they are present at the base of the hair follicle. Now coming to the etiology of the external hordeolum, predisposing factors are age. Most commonly occurs in children of young adults, patients with eye strain due to muscle imbalance. Okay, refractive error. It is habitual eye rubbing, fingering in the eyelids and the nose, chronic blepharitis, diabetes mellitus. In patients of diabetes mellitus, there is a recurrent stye formation because as there is immunosuppression. And next is metabolic factor, that is excessive carbohydrate and alcohol intake. Cause to organism is the Staphylococcus aureus. Now coming to the clinical features of external hordeolum, there is a painful swelling of the lid margin. There will be mild watering and photophobia. Signs of external hordeolum are there are two stages: stage of cellulitis and stage of abscess formation. In the stage of cellulitis, there is localized firm, red, tender swelling of the lid margin with lash at its apex. Okay, as a, there is a inflammation of the hair follicle. Okay, base of the hair follicle. There is associated with marked edema and one style most commonly, or multiple styles may be present. Okay, stage of abscess formation, visible pus point at the lid margin, and it is and there will be the affected cilia. Okay, treatment: you should give hot compression 2 to 3 times a day in a cellulitis stage. And when pus point is formed, evacuation of the pus by epilating that cilia, means you should plug that hair follicle. Okay, next there is a surgical abscess removal if there is large abscess formation. To control infection, antibiotic eye drop should be given 3 to 4 times a day and eye ointment at the bedtime. Okay, this is for external hordeolum. We will give systemic anti-inflammatory and analgesics, that is to relieve pain and reduce the edema. We will give systemic antibiotics, and in diabetes cases, early control of the infection, and in recurrent stye, oral antibiotics along with treatment with other predisposing factors. This is a picture of external hordeolum. You can see there is you can see the opening is present at the lid margin. Okay, this is hordeolum externum. It is a acute suppurative. Okay, gland of Zeiss and gland of Moll. Now coming to hordeolum internum, it is a suppurative inflammation of the meibomian gland associated with blockage of the duct. Okay, that is external hordeolum because of gland of Zeiss and gland of Moll. Okay, internal hordeolum, it is because of meibomian gland. Okay, etiology is a predisposing factor, same as that of external hordeolum. Causative organism is primary infection of meibomian gland by Staphylococcus infection. Secondary infection is by chalazion. Okay, infected chalazion. Now coming to the clinical features of the hordeolum internum. Okay, symptoms: there is acute pain, more intense. Okay, there is here pain is more severe than the external hordeolum. Okay, acute pain, more intense, severe throbbing, as swelling being embedded deeply in the dense fibrous tissue. Okay, there will be swelling of the lids, mild watering and photophobia. Signs: swelling of the lid, there is localized, firm, red, tender, associated with marked edema. On examination, maximum point of tenderness, swelling away from the lid margin, pus point on the tarsal conjunctiva and not on the root of the cilia. Okay, and at the opening of the meibomian gland. Pus points, and there is yellow area on the everting lids. Okay, you can see meibomian glands are present in the posterior part of the lid margin. Okay, therefore the hordeolum internum will be away from the lid margin. The differential diagnosis is the external hordeolum externum. Treatment: drainage of the pus by vertical incision from the tarsal conjunctiva. Okay, I want you to know meibomian glands are see this is the lid margin. Meibomian glands are arranged like this. Okay, like this. So you should give vertical incision so that you cannot damage other meibomian glands. If you give horizontal incisions, all the meibomian glands get cut. Okay, that's why try to give vertical incision. Complication is the chalazion itself. Now coming to the this is a picture of hordeolum internum. You can see the pus point is away from the lid margin. Okay, and it is present on the lower lid margin. Meibomian glands are arranged like this. Okay, like this. Now coming to the difference between hordeolum externum and hordeolum internum, both are formed due to acute suppurative inflammation. Site of inflammation in hordeolum externum is a gland of Zaysin, glands of Moll, okay, and in hordeolum internum is meibomian gland. Hordeolum externum is painful and internum is more painful. Here, the location of a point of swelling will be at the margin, at the base of the apex in the hordeolum externum of the hair follicle. Okay, in hordeolum internum, away from the lid margin, pus point appears through the conjunctiva posteriorly. Okay, because of meibomian gland. That's it.